Mm-hmm. Mm-hmm. Well, so that I want to know more about self energy, but I want to pause on knowing more about self energy yet until it is important to weave it in, because you had said
Yeah.
something there which you might have referenced earlier, but is not clearly explained just yet, which is you're asking for permission. Maybe
Yes.
you can explain that in the context of what I mean, we've been talking about what an IFS process looks like, but maybe give us like a case report in the sense of like step by step. What do you do? What are you seeing? What are you engaging? What does it look like when someone comes in for an IFS session? What is the process of getting to the place where a healing can happen?
Yeah. So a couple things about that, and that's another one of those unique elements of IFS is get permission, get permission, get permission. Okay. I've trained in EMDR. I'm trained in sensory motor psychotherapy. I've done all the kind of trauma related healing modalities, and they all offer something valuable for sure. Um, but one of the things that IFS does is that we don't move forward unless the protective parts give us permission. Okay. EMDR, for example, doesn't do that. You can set up an EMDR protocol, but you haven't really asked all other parts if they're okay with this. Okay. And this is why sometimes you can get backlash or catharsis, like a reliving of things.
Mm-hmm.
Okay.
So
So
backlash,
IFS,
like you go to a session and they just like go right in there and you're like, wow, that went so, you're like walk away, you're like feeling so good. You're feeling nervous and anxious going in, but you feel so good and you're driving away and then you're having a panic attack
you got it.
10
Yeah.
minutes after your session.
Because some of these protective parts did not agree to this work, and they have issue with moving forward, accessing that vulnerability in that way. So they'll be held to pay on the back end. Yeah, that's exactly what I mean by backlash. We really don't do that in IFS. So, for example, a typical session could be, hi, nice to meet you. I'm really struggling, and people will tell you a bunch of different things. Like I think I'm drinking too much. I'm fighting with my wife a lot and I yell at my kids. Okay, those are three different parts. So I'll say, okay, so there's this part that's drinking too much. Is that right? There's a part that's yelling at your kids a lot. And I also hear there's another part that's not getting along with your wife. Which one of those would you like to focus on? So it's client driven. You decide what we call the target part is. And they may say, you know what? Really feel bad about yelling at my kids. Let's go there first. Okay, great. Now I say this is a shift to internal focus. IFS is not talk therapy. It's about having the clients be with themselves and in their system. That therapist is an adjunct. Okay, it's not the primary healer. Okay, so we have the client start moving towards that internal exploration. Could you get to know that part of you that yells at your kids a little more? But before we do it, let's make sure the part that drinks and the part that's angry with your wife is okay with us proceeding. We really move forward with permission every step of the way. Okay. And if there's not consensus, then we won't move forward. We stay there. Oh, wow. Okay. So the part that yells at your wife doesn't really want us to proceed. Let's hear more about that. I bet it has a good reason why it doesn't want us to. Constantly working with these protective parts, gaining permission before we proceed. Okay, we're not pushing any part in any way. Okay, this is one of the reasons why we in IFS don't do this kind of building resources or building self to tolerate the pain. We don't move to the pain unless everybody agrees. So it's a very, and we have a whole process. There's steps of working with protective parts. For example, could you focus on the part? How do you feel toward the part? Let's find out its job. Let's understand its fear. Let's have you, client, access your self energy so your self or your core can be in relationship to your part. So it's an internal, like think of IFS as an internal attachment model. It's really not about the therapist providing this kind of resource so the client can heal. It's about the therapist helping the client access their inner resource or their higher self or self energy, whatever words you want to use, so that that inner resource within is the primary healing modality with therapist help. So we're really working on the internal relationship between the self and the parts, and we guide them through the steps of healing.